Dr. Blake's taking here at Westside-Medical. Today we're going to go over stuff you do at home for anterior shoulder impingement. So what it is when you raise your arm up, the head of the humerus, or this arm bone right through here, it impinges the soft tissues around the AC joint. So when you lift the arm up, this humerus rises too high, and then it pinches right through here, causing pain. So there's a couple things you can do. First, what you want to do is you want to release this posterior capsule. So first, the soft tissues back here, when that gets tight, it pulls the humerus, the arm bone, up. And that already sets that into a position where when you raise your arm, it's going to jam. And the next thing you want to do is you want to strengthen the rotator cuff muscles, like the ones in the front, the ones in the back. Because when those are strong, what happens is when you raise your arm up, the rotator cuff actually pulls that humerus in, so it locks it down, so you have that room to raise your arm. Good. So the first thing we want to do is we want to release this back shoulder here. And we do that through the sleeper stretch, which we've done some videos on, but I'll demonstrate again. So the first thing you can do is, with your arm at 90 degrees, and you're going to pull down like this and hold for 2 minutes to stretch that posterior capsule. And then to add a variation, you take the cross ball, you put it back there, and you can kind of get your weight up on it, and you roll back and forth like this to do the cross friction. Maybe about 3 to 5 reps through there, loosen up, and then you kind of put your weight on it, and then go to the sleeper stretch also. So you take the cross ball, compress it, you're going to push that arm down, and just hold. That's going to really pull open that capsule there. And that's going to release that posterior capsule and let your humerus drop down. So the next part, we're going to show you how to strengthen the rotator cuff. There's a couple ways to do it. We'll show you some basic ones first. The first basic one is you get a band here, and you keep your elbow pinned to your side, and you're just going to rotate out like this. And that's for the back portion of the rotator cuff here. If you want to get fancy, it's the teres minor infraspinatus muscles. So that's the back of the rotator cuff. So you can knock out maybe 3 sets of 10 like this. You're going to come through here, and now you're going to work the anterior part of the rotator cuff, the subscapularis. So once again, you keep your elbow pinned to your hip, and it's going to rotate just like this. And that's for the internal rotation of the rotator cuff. And some variations that I like to do, I like to change the angle sometimes, where you can step up like this. You're going to just arm up, externally rotate this way for the posterior rotator cuff, just like this. Once again, you can do about 3 sets of 10. And then you can go and just do it the other direction, pull in like this. That's internal, that's going to work the subscap. Right like that. And if you're working on both shoulders at the same time, let's say maybe you have like bilateral shoulder impingement, you can do this at the same time. You kind of do a variation. You can pull up like this, that gets the posterior rotator cuff. You can also pull up like this, so you're doing both arms at the same time, working the back of the rotator cuff. And you just pull it forward like this through here, lean forward a little bit, and pull just like this, that internal rotation, to work that front of the rotator cuff, that subscap. So to recap, what you want to do is you want to loosen the tissues in the back through that roller using the lacrosse ball and that sleeper stretch. And then you want to make sure you strengthen the muscles of the rotator cuff to pull that humerus in. So that's going to let your arm go through that full range of motion without that impingement through the front of the shoulder. So hopefully that helps you guys out.